Hey everyone, Dr. Callanan here. Today I want to present to you a quick webinar on digestive health, but also present to you the new Probiomed products that Designs for Health have launched. They've launched the Probiomed 50 billion as well as the 100 billion. If you have never met me, again, my name is Brianne Callanan. I'm a naturopathic doctor and I have a clinic in Saskatchewan as well as Ontario. And in this presentation, I've included real case studies from my practice to show you where I would use these products and the clinical outcomes that I expect when using these treatment protocols. I am also the Designs for Health Regional Territory Manager in Ontario. I am the Ontario Rep Manager, but if you're watching this video from other parts of the country, you are more than welcome to get in contact with me. I'm happy to connect with practitioners and brainstorm treatment protocols. I love to hear what you're doing and I love to connect. So I'm not going to take too much of your time here. This is going to be a short presentation. And if you have any questions, please post them in the comments or feel free to send me an email when you get this recording. Okay, so here we go. High-dose probiotics. High-dose probiotics influence the gut health and immunity in ways that lower-dose probiotics cannot. We're going to be diving deep into the clinical strains that Designs for Health has chosen to use in their probiotics, as well as the clinical evidence that suggests that we use these strains. This is why I love Designs for Health, because they are research first. They are choosing not only human strains, but they're choosing human strains with specific clinical research, and they're using the dosages, which is really important, that the research suggests showing that is effective. High-dose probiotics can also be used in cases of acute gastrointestinal illness as well as immune challenges. So we're talking IBD, we're talking acute flares, we're talking celiac disease exposures, and immune system challenges. A significant portion of my practice in Saskatchewan is actually autoimmunity. So I'm using probiotics a lot because I love the way that they modulate the immune system. And if you've never had a chance to look at the Designs for Health tech sheets, the Probiomed one is amazing because it has this really awesome chart that breaks down all the different probiotic strains that are used and how they immunomodulate the immune system. They have also highlighted the probiotic strains and why they've used them and what clinical research is associated with this human strain. So this is a great resource that you can share with your patients to explain to them why you're using this specific probiotic and why it's different than other probiotics, which we're going to touch on at the end of the lecture as well. High-dose probiotics, like we said, are involved in immune and inflammatory signaling, so it plays a really big role, not only in GI, but as we know, we are treating holistically, so modulating that immune system. And a significant portion of the immune system, as you all know, is contained in the gut, which is really exciting research. High-dose probiotics, we're going to use them in irritable bowel disease because they reduce immunological disturbances, they decrease the disease activity, and they normalize intestinal permeability. If you've ever run a stool test and you're looking at zonulin, that is a marker from intestinal permeability. Probiotics can modulate that, removing food sensitivity, specifically gluten, if they have elevated levels of anti-gliadin IgA present. That could be suggestive of a gluten sensitivity, and removing that will assist in normalizing this intestinal permeability and reducing zonulin levels. In the cases that I'm going to show you from my Saskatchewan practice, these are case studies from the GI MAP test, which I've been told is coming really soon to Ontario, which is really exciting, to be able to have access to that here as well. High-dose probiotics can be also used in irritable bowel syndrome. So I use this a lot in IBS, reducing pain, reducing discomfort, reducing bloating. And interestingly enough, in those who have diarrhea, it improves the diarrhea symptoms. And in those who have constipation, it really helps with those constipation cases, specifically in those who are not having at least one bowel movement a day. High-dose probiotics are also associated or suggested to be used in antibiotic-associated diarrhea because they preserve the commensal bacteria and they help with the GI transit time. So they're going to be improving diarrhea if they're noticing diarrhea associated with antibiotic use, and we've seen improved stool consistency and frequency. They also outcompete for receptor sites. So typically those infections don't have the opportunity to grow when you are giving a high-dose probiotic to clog up those receptor sites or compete for those receptor sites, more to say. So here's the first case. The first case is a 26-year-old female who came to me with significant bloating, and she couldn't really figure out why. She had looked at doing an elimination diet, she removed food, she couldn't pinpoint anything that was really aggravating her. She was noticing that the bloating was getting worse as the day goes on. Nothing really seemed to improve it. She was also experiencing constipation. She would have one bowel movement every 3 days. On occasion, she would have one every day, but it was few and far between. And she reported her stools as being sticky. And when I asked her, does it take excessive wiping to get clean after having a bowel movement? And she said, yes, I label those patients as hyper wipers. And this is just an indication of fat maldigestion. She was noticing oil in her bowel movements as well as it sticking to the toilet bowl. So I wanted to confirm that fat maldigestion, malabsorption, and we did the GI map test to have a look at that. She also described herself as having poor immune health. So she seemed to catch everything her kids brought home, and she was getting more sick frequently than she had been used to. She was following a very healthy low-carb paleo autoimmune diet already, and she was concerned with her history, her family history of autoimmune disease, which is why she tried out the autoimmune paleo diet. Very health conscious, doing everything seemingly right, but she just couldn't get rid of these bloating symptoms that she was experiencing throughout the day. So here's one page from her GI map and what it showed. And the first thing that we picked up here was significantly elevated H. pylori. So you can see it's 1.1 to the power of 7, and normal is less to the power of 3. And she also had a positive virulence factor. So a virulence factor is just indicative of how pathogenic this H. pylori is. There's lots of people that have H. pylori present and they don't have any virulence factors and they don't present with symptoms. And if that was the case, I typically would not treat that. But in her case, because her symptoms were pretty significant and she had this positive virulence factor, we decided to go ahead and treat the H. pylori infection. We're also noticing dysbiosis here. So we're noticing low levels of these normal bacteria flora. She was taking a probiotic, a lactobacillus containing probiotic. She did stop it a couple days before, but you can even see just on normal levels, very, very low levels of lactobacillus, escherichia, etc. And this suggests that we need to support her gut in order to have enough of this healthy normal bacteria flora so that it cannot allow the opportunity for other bacteria and pathogens to grow. We're also noticing high levels of Enterobacter species. And when this goes high, it's indicative of reduced mucosal health. So it's not excessively high, it's still to the power of 7, but it's something that we want to keep an eye out for because we're seeing low levels of these normal bacteria, then high levels of a strain that's showing us that there's reduced mucosal health in some way, and we need to really look at the root cause of why that's happening. She also has low levels of Firmicutes. So Firmicutes, bacteriocytes are just classes. So the same way you have dog and you have cat are classes of animals, then you have husky, Yorkie, all different species of dog in there, the same with cat. That's what this phyla is just recognizing. And I actually really pay attention to this FB ratio because if it's over 1, it's been associated with extracting more calories from the food you eat, insulin resistance, diabetes, and obesity. And that's something I also focus on in my clinical practice. So we can see hers is nice and low, which is, you know, we really do need to help her with her Firmicutes, getting this lactobacillus higher so that she can have a healthier distribution of normal bacteria flora. So what did we do? So first what we did is we treated the H. pylori. I used the Probiomed, contains DGL, mastigum, zinc, methyl methionine sulfonium, not sure if I'm saying that right, but this is known as, or it has been called vitamin U, and it's from cabbage. It's been really helpful in ulcers as well as helping with H. pylori infection. Probiomed also contains a decent dose of vitamin C as well, and we were giving her 2 caps BID on an empty stomach. This is my go-to for anyone with gastritis, anyone with GERD, H. pylori type symptoms, as well as ulcers. This one works really, really well. I did also, in addition, give her BronchoProtect. I think this is my favorite supplement. I am huge on the sulforaphane. I love sulforaphane. There's so much research on it, everything from cardiovascular disease, Alzheimer's, cancer, as well as H. pylori. There's really good research. If you just look at sulforaphane and H. pylori, you're going to have a lot of studies come up. And specifically, the sulforaphane that's in the BronchoProtect, which comes from broccoli seeds, prevents H. pylori associated or induced DNA damage. And I give anywhere from 1 to 3 capsules a day. Side note, if you are running a Dutch test and you're seeing elevated levels of 16-OH, this is the type of estrogen that can go on to form quinone adducts and damage DNA. The sulforaphane is indicated in that as well because it helps to induce NRF2, which helps to repair that DNA. The more DNA damage you have, the more DNA repair that you need. So of course, food first. If you can get your patients to have cruciferous vegetables and broccoli sprouts, that's going to be a start. But if they're not having high enough levels, the BronchoProtect is an amazing supplement to include. It's in my personal everyday supplement list that I take. For her dysbiosis, I chose to use the Probiomed 100 because I felt like she needed the higher dose acutely, and then we would drop that down to the Probiomed 50 as her maintenance dose. I also asked her to increase fiber in her diet to promote the growth of more healthy normal flora. Okay, this is another page from her GI map, and you can see here, you know, this additional dysbiotic or overgrowth bacteria, it's not above the normal range, but there are things that are starting to grow here. And given the opportunities, these will go higher if her normal flora continues to be low. She also had, you know, it's not without the normal range, but Candida species was living there as well. So this just showed me again that that low beneficial flora is allowing the opportunity for this additional dysbiosis to grow, and this is not something that we want to continue going down this path. So it was really important to support her normal gut flora. She was also showing reduced digestive capacity. So on the GI map, you can look at elastase, which is a marker of, you know, pancreatic function, how well you're breaking down your proteins. Yes, it's above normal, but it's not optimal. And her steatocrit was high. So remember, she reported those sticky stools. She was reporting or showing here a significant amount of fat malabsorption. So what I did is I gave her digestymes. I gave her 2 at every meal to help improve both her elastase and her steatocrit because of the suboptimal elastase. There's also, in the digestymes, there's HCl, there's ox bile, there's digest gluten, which is the DPP4, there's lipase to break down your fat. It's really this, I call it as a safety net to my patients. So if they're gluten sensitive, if they're dairy sensitive and they're going to a restaurant, or they're indulging because they just want to, I say at least take your digestive enzymes so you help break those down. But the ox bile makes a really big difference, specifically in those who can't break down fat, or even in someone who doesn't have a gallbladder and they're not producing enough bile. Her beta-glucuronidase was normal. That's a marker of estrogen recycling, no blood in her stool, which is great. Secretory IgA, it was within normal range. Her anti-gliadin IgA was within normal range. She also was gluten-free. She was following a gluten-free diet, so we wouldn't expect this to be elevated anyways unless she was getting cross-contamination. So it looks like she was maintaining her gluten-free diet in a way that would be acceptable for her immune system. Inflammation was under 50, which was great, and zonulin, her leaky gut marker, was actually within normal range, which is awesome as well. So really what we needed to do is we needed to give her the digestive enzymes, we needed to reduce the H. pylori, and we needed to provide her normal bacteria with some support to get those levels up to the normal range. Case number 1. Okay, case number 2. This one is just highlighting another page of the GI map. I wanted to show you some variations. So again, this patient was showing fat maldigestion. So we're going to do the digestymes as well with the ox bile to support that. Here, this patient's beta-glucuronidase was really, really high. So any patients who are struggling with estrogen dominance type symptoms, it's either, you know, the liver's not breaking it down, they're not clearing it as well. Maybe they have increased fat tissue, which is producing too much estrogens. Maybe there's estrogens in their environment. So if you take care of all that, but they're still seeing these estrogen dominant symptoms, it could be that the liver is detoxifying the estrogen's fine and releasing it into the GI system, but the bacteria is working on that, essentially taking off what has been cleaved and recycling the estrogen. So here, if I'm seeing elevated levels of beta-glucuronidase, I'm going to give calcium D-glucarate to help lower that, and that is a new product as well that Designs for Health has launched this year. Fecal occult blood was negative, which was awesome. Here we're seeing levels of increased secretory IgA. So when I see levels of, they're low secretory IgA. When I see low levels of secretory IgA, you really need to look at the full picture. We know that Lactobacillus acidophilus specifically will help raise IgA, and that is in the Probiomed 50 and 100. So if this patient had low levels of lactobacillus as well and low secretory IgA, I would choose the Probiomed. Now, if they had normal levels of all their gut flora, normal gut flora looked good, just low secretory IgA, that's where I'm going to be moving more towards the Saccharomyces boulardii, because that's been shown in research to increase IgA as well. Other things to help with IgA levels, you can't see my slide there, but we know that stress can reduce it, as well as nutrient deficiencies such as vitamin A. So you kind of want to look at the full picture to see why their secretory IgA is low. And if you're seeing low levels of normal flora, Lactobacillus acidophilus, Lactobacillus ramosus, those two have been shown in clinical research to support IgA, and those are in the Probiomed 50 and 100. So If you don't know what their normal flora is, you can always try out that multi-strain probiotic to see if that makes a difference. And if you're not seeing the clinical outcomes that you want, you can try to either substitute it with the Saccharomyces or add them both together. Her zonulin levels were also really good as well, which is great. Next one. Case number 3. So this patient was a little bit different. We're noticing that she's digesting fats. Her elastase level is within a healthy range. Beta-glucuronidase within a healthy range. Secretory IgA is low. So again, you can support this with either the Probiomed or the Saccharomyces, or look at nutrient deficiencies that you might need to do to support the IgA. But here, calprotectin is very, very high. In this case, I specifically used the 4R approach that you've probably heard a number of times, which is remove the cause of infection. So this patient in particular had a significant parasitic as well as bacterial overgrowth. So what I did to clear that is I used the GI Microbe X, and I used 2 caps TID. So the recommended dose on the bottle is 2 caps BID, but I just find doing the TID really helps eradicate those infections at a faster rate. But you always want to base it off of your patient that's sitting in front of you and what they can tolerate. So that's just what I do, 2 caps 3 times a day with the GI Microbe X to remove the infections. You also want to replace the digestive ability. So while these levels were okay, we're still noticing that there's changes to the immune system, and there still is some fat present in the stool. So I decided to use the Digestzymes. I use Digestzymes on almost all my patients because if they're eating on the run or they're stressed in any ways, if they're not cooking their own foods, they're probably not producing enough stomach acid and the digestive enzymes that they need to absorb their minerals and nutrients from their foods. If they're not producing enough stomach acid and enzymes to break down their foods, they're also not going to be absorbing their supplements as well. So my go-to is really to replace the digestive capacity in the stomach. So we removed the cause, we replaced the digestive enzymes in the HCl with the Digestzymes. And then we were inoculated in this case with the Probiomed 50, and we repaired. So although her zonulin levels were still normal, they're higher than the other cases that we've seen, indicating that there is some leaky gut present, and there is a lot of inflammation in the gut here. So we looked at an anti-inflammatory paleo diet for this patient, as well as used the GI Revive, one of my favorite products for inflammation in the gut, and we used that a tablespoon just at night. I like my patients to do it at night in a little bit of warm water. Some practitioners do it in the morning. It's really your style, whatever resonates with you. I'm not sure why I do it at night. That's just what I've always done. And I love the GI Revive because it's a powder, and you can adjust it for kids as well as people who are sensitive to it as well. And I find that the GI Revive, they'll notice symptom improvements within a couple days, depending on how long their bowel transit time is. So if their bowel transit time is 1 to 2 days, then they typically notice a change within 1 to 2 days, either in symptoms of gas, bloating, or they're noticing stool consistency changes, which is really awesome. I used the GI Revive actually in my son who had elevated zonulin levels, as well as he had anti-gliadin IgA levels that were elevated. So we removed gluten, used the GI Revive, and he came back with a clean GI map after, which was really cool to see. Who else benefits? Okay, so if you have an elevated calprotectin level, which is indicative of inflammation in the gut, this is a marker of neutrophil-driven inflammation, mucosal inflammation. That could be an IBD, Crohn's, ulcerative colitis, celiac that's unmanaged. And the Probiomed really helps modulate that immune system to reduce the levels of inflammation in the gut. As you can see in this patient here, this anti-gliadin IgA is high. So what we want to do in this patient as well is remove the amount of gluten in their diet, because that's obviously aggravating their immune system as well. So here's the label for Probiomed 50. What makes it unique is it's 30 servings per bottle. I love that it's shelf stable. To not have to have a probiotic that has to be kept in the fridge, you can keep it with all the other supplements so you don't forget. You can throw it in your bag on the run. I really love that aspect of it. It's completely shelf stable. It's 10 strains, so it truly is a multi-strain probiotic. And it's not like they've optimized the dosages of 2 to 3 strains. They've really looked at the clinical research and made sure to include clinical relevant dosages of all these 10 strains. No strain is under 1 billion, which is really, really awesome, because you truly, if you want a broad spectrum probiotic, they need to be broad spectrum, not only including all the strains, but also including them in relevant dosages. Input at manufacturer is disclosed. So the 50 billion at time of manufacturing is actually much higher, and the Probiomed 100 is much higher than 100 at time of manufacturing. So they've really given you extra dosages. So if you were to consume these closer to the date of time of manufacturing, you'd be even getting a higher dose than what is saying on the label. And it's this really cool CSP bottle, which I'm going to touch on in the next slide. Not in the next slide. In the next slide after that, we'll talk about the bottle. So here is the comparison chart. This is on the tech sheet, which you can download or you can grab from your rep. I really love this because they've chosen these strains because they have low pH resistance, which means that they'll be able to get through the pH and still survive and get to the place they need to be, bile acid tolerance. And they're looking at the resistance here and how tolerant it is. I think this is really important to ask when you're looking at a probiotic, how much is actually surviving, how much is actually resistant, getting to where it needs to be to produce the effects that you want. Mucosal adherence is also really important because even if it makes it to the large intestine, you want to make sure that it adheres to modulate the immune system and have those clinical outcomes that you want. And the immune modulation here is really significant. So remember when I was saying, you can use Saccharomyces boulevardiae to impact or increase IgA levels. We know that it does that through clinical research, but the Lactobacillus rhamnosus also does that one as well. Here's the interleukins that it affects. Really, really awesome. The tech sheet goes into more detail breaking down each of these strains and what clinical outcomes they have. Some of them actually have been shown to reduce insulin resistance, decrease HSCRP. So really a whole body approach. We know that a lot of issues arise from gut dysbiosis or gut issues in general. So it's really a holistic approach, approaching it not just from GI complaints, but autoimmunity, brain health, inflammation in general, pain, constipation, etc. So this is the CSP desiccant sleeve. So when you get a probiotic and it has that desiccant sleeve in it, it kind of looks like what you get in a shoebox. I always take it out and I throw it out. Turns out you're not supposed to do that because that's what absorbs moisture. And you don't want any moisture getting into your probiotics because then they become activated. And if they're activated, then their potency reduces. So this is what the industry standard bottle does. They put that desiccant sachet inside of it, and it really doesn't get all the probiotics exposed. And you can still have moisture getting into these probiotics, and then they're not as shelf stable. But what Designs for Health has done, and the bottle is really cool, when you open it up, the entire bottle is surrounded in a desiccant sleeve so that all of your probiotics are protected. And this is it's one of the aspects that allows it to be shelf stable. So I thought this was a really cool, innovative way to create a shelf stable probiotic that would sustain the potency in addition to adding in extra probiotics on top of what is said on the bottle. So there's virtually no moisture because the moisture is trapped before entering the headspace. So this is really cool. I've never seen anything like it. So definitely when you get your bottle, open it up and have a look at how that sleeve is presented. Probiomed is also dairy-free. Of course, all of Designs for Health products are gluten-free. We do have whey protein. We do have whey protein-based bars. But other than that, the entire line, besides the whey products, are dairy-free as well. So there's no wheat, no eggs, no fish, no peanuts, no milk, nuts, celery, sesame seeds, etc. In the Probiomed, both the 50 and the 100. So this is the 100. Again, it's 30 servings, 10 strains, no refrigerating required, same bottle, and you'll get the manufacturer dose at time, or the dose that they put in at time of manufacturing on this one as well. 50 I typically use for more of my maintenance or general GI health, and then the 100 I really reserve for acute flares or really, really low levels of normal bacterial flora in the gut. So I hope that was helpful for you. I think that's all we put together. Oh, no, there's one more slide. So this is the GI Map Interpretive Guide. This is actually a resource that Designs for Health has put together to help interpret the GI map. I use this as a resource all the time. Even if you don't have access to the GI map right now, this would be a great resource tool for you. It goes through the 4 R's that we talked about, something that we all probably incorporate into our practice as well. It breaks down, what bacteria are part of the Firmicutes class, which bacteria are part of the Bacteroides class. It looks at pathogens and how to treat them, suggested treatment protocols. So this is a really great resource. Designs for Health is truly a resource and education company. They're here to support your practitioners. Your reps are very, very knowledgeable, and they can find the answers for you. We have an amazing medical advisory team as well that I contact nonstop for, can we use this here? What are your thoughts on this? What would the protocol be for this? We're coming out with a new protocol manual. So the amount of education and resource that you're getting with Designs for Health is truly amazing, and something that I'm really, really proud of to be connected with this company because of all the amazing resources that they share, in addition to having fabulous products, of course. Fabulous products that work for sure. Okay, so that is the end of the presentation. I don't want to take too much of your time. I hope you found that helpful. Again, you're welcome to contact me with any questions or concerns that you have. Again, Dr. Brianne Callanan from Designs for Health. I hope you have a great evening.